Acute otitis media. What is acute otitis media? Acute stands for abrupt onset. Ot stands for ear. Itis stands for infection and inflammation, while media stands for middle ear. So, acute otitis media means inflammation of the middle ear. What are the stages of acute otitis media? 1. Stage of tubal occlusion. Since the middle ear drainage is entirely dependent on eustachian tube. The first step in acute otitis media is the blockage of eustachian tube. Children are particularly predisposed to acute otitis media because their eustachian tube is shorter, wider, and more horizontal as compared to adults, which increases the chances of their eustachian tube getting blocked. 2. Stage of pre-suppuration. After the eustachian tube is blocked, the microorganisms start infecting. 3. Stage of suppuration. This is marked by formation of pus in the middle ear. Tympanic membrane starts bulging to the point of rupture. 4. Stage of resolution. The tympanic membrane rupture with release of pus and subsidence of symptoms. Inflammatory process begins to resolve. If proper treatment is started early, or if the infection was mild, resolution may start even without rupture of tympanic membrane. 5. Stage of complication. If virulence of organism is high or resistance of patient poor, resolution may not take place and disease spreads beyond the confines of middle ear. Treatment. 1. Antibacterial therapy. It is indicated in all cases with fever and severe earache. 2. Decongestant nasal drops. Nose drops should be used to relieve eustachian tube edema and promote ventilation of middle ear. 4. Analgesics and antipyretics. Help to relieve pain and bring down temperature. 5. Ear toilet. If there is discharge in the ear, it is dry mopped with sterile cotton buds, and a wick moistened with antibiotic may be inserted. 6. Dry local heat. It helps to relieve pain. 7. Myringotomy. It is incising the drum to evacuate pus, and is indicated when A. Drum is bulging and there is acute pain. B. There is an incomplete resolution despite antibiotics when drum remains full with persistent conductive deafness. C. There is persistent effusion beyond 12 weeks. All cases of acute suppurative otitis media should be carefully followed till drum membrane returns to its normal appearance.